Hi, my name is Dr. John Mergen, and today we'll be answering questions most commonly asked by patients. The most common time for children to be seen for their first consultation would be around age 6 to 7. And the reason that we recommend that is that's the time frame when the facial growth and development is occurring the most for especially mid-face area, which is the upper jaw, the nasal airway, and the jaw width. What's going to provide the most stable result for your child's final treatment will be actually being able to see that child at the proper age so that we can provide treatment at the proper time. With growth and development, it's very important to be able to intervene at proper growth and development time periods to help with and direct growth and dental eruption to get the best result for patients. No, your dentist does not need to refer you for orthodontic care. As dentists, obviously, we know where big problems are, like crowding issues or where the bite's off. But as orthodontists, we're specially trained in being able to understand what underlying issues are and also help with growth and development so we can get the best result for your child's overall treatment. Being able to treat your child at the proper time is the whole key. We always want to avoid extracting teeth. A lot of orthodontists that if we don't know how to take or expand arches to help with development and growth, then we're not able to create the space that we need for teeth. And then orthodontists are extracting teeth, and that's not necessary. Yes, there's other options compared to a palatal expander. So I've been an orthodontist for 28 years. Obviously, in the past, I've actually used palatal expanders. Over the last 18 years, I've actually been using Invisalign. We can actually expand much better with Invisalign versus palatal expanders. Also, they're not as barbaric as palatal expanders either. The other nice thing is we're able to expand not only in the upper arch, but also in the lower arch also. So we want to be able to expand both arches to keep the bite relationship in its proper relationship also. Yes, there's a lot that we can actually do with sleep apnea, but the whole key is early on. And so around age 7 is when permanent teeth are just starting to come in as far as front permanent teeth, back permanent teeth. That gives us something that we can actually use with appliances like Invisalign to help expand arches. When we expand the upper arch, that actually expands the nasal airway. And so that allows patients to be able to breathe through their nose better. And then also expanding the lower arch and upper arch, that creates more space for the tongue. And then that allows space for the tongue so the tongue's not getting pushed back in the throat, closing the airway, causing sleep apnea issues. Some signs that you can recognize with sleep apnea would be such things as mouth breathing, snoring. Patients sometimes grind their teeth, and also restless sleep. Invisalign providers are going to be all different, so it's all dependent on that provider's experience. As far as treatment, it's very dependent on the type of problems that you have and then also what we're actually using for treatment. Invisalign is actually a much more efficient treatment product. We can actually get treatment done a lot more efficient with Invisalign, anywhere from 14 to 18 months. Normally, we're going to see you every couple months. If you go braces route, braces usually are going to take a lot longer. It's going to be 2 to 3 years. Those are some of the most commonly asked questions by our patients. Hopefully, I answered some of your questions also. If you have any more questions, feel free to call us at our office, and we're more than happy to help you at any time.